Hi, welcome to Pathology Riddles. So the topic for today is repair and healing. Whenever there is an injury, how does the body respond? There are basically three things which the body tries to do. Whenever there is an injury, there will be bleeding. So body will try to stop the bleeding by clot formation. Whenever there is an injury, there will be organisms or foreign body which enter into the injury site. So body will try to deal with it by having inflammation. Then the third thing the body will try to do is repair itself. What do you mean by repair? Repair is actually restoration of tissue architecture and function after an injury. The term repair is used mainly for parenchyma and connective tissue, while the term healing is used for your surface epithelium, although both can be used interchangeably. So whenever you are asked about repair or healing, you have to write the same answer. How does repair happen in our body? So it can either be by regeneration or by connective tissue deposition or scarring. So regeneration. So regeneration will be either by uninjured tissue which are surrounding the injured area, they will start proliferating, or the stem cells which are there in that organ will start maturing and filling up the gap. So this is how regeneration happens. Do all the cells have ability to proliferate? The answer is no. There are mainly three types of cells according to their proliferative capacity. The first one is labile cells. Now these are the cells which are continuously getting replaced either by proliferation of mature cells or by the maturation of stem cells. So the examples of these cells are the squamous epithelial lining which is there in cervix or vagina, or the lining of gastrointestinal tract. All these cells come under labile cells. Second type of cells are stable cells. These cells have limited proliferative capacity or very limited ability to regenerate. Now these will only divide when there is a injury or resection of the organ. Examples of these cells are liver cells, pancreas cells, which will divide whenever there is a resection or whenever there is a big injury to these organs. So the third type of cell is permanent cell. These cells have lost their ability to proliferate and they do not proliferate after birth. So examples of these cells are neurons, cardiac muscles, etc. So regeneration will happen only in the cells which have ability to divide. Basically labile cells and stable cells. Only these two type of cells will have ability to regenerate. The third type of cell, that is permanent cell, they will have what you call as scar formation or connective tissue deposition. Another important aspect to note is that even in stable and labile cells there can be scar formation. This is usually when there is a very severe degree of injury. The mechanism of regeneration can be explained with the example of liver. Whenever there is a partial hepatectomy or liver resection, there will be regeneration in two phases. The first stage is priming phase. In this phase, the Kupffer cells which are lining the sinusoids will release interleukin 6. Now interleukin 6 is basically a cytokine which will go and act on hepatocytes to prime them so that they react to the growth factors which will come to them. The second phase is growth factor phase. Now there are two growth factors. First is hepatocyte growth factor and second is transforming growth factor alpha. Now this hepatocyte growth factor is being produced by the endothelial cells and the stromal cells. Now this transforming growth factor alpha is being produced by activated macrophages. These two growth factors will act on hepatocytes which are already primed by the action of interleukin 6. These hepatocytes will now be transferred into cell cycle. So they will start dividing. So this brings us to the third stage, which is the proliferative phase. So first the hepatocytes are going to proliferate, divide. Then non-parenchymal cells like your stellate cells, endothelial cells, Kupffer cells will proliferate. Now once the whole proliferation process is done, there will be some anti-proliferative factors which come from the transforming growth factor beta family. So this will put a stop to all this proliferation. In some cases, this proliferative capacity of hepatocytes will be impaired. mainly in cases of chronic liver injury. So in these cases, what will happen is the stem cells which are present in canal of herring will start proliferating. So they will do regeneration of the organ. So basically these are the two steps in regeneration process. In the next episode we will be dealing with repair by scarring. If you like the video, please do press the like button. If you are watching the video from our channel for the first time, please subscribe, and I'll see you in the next episode.